It's that time of the week, time to answer your common health questions. Joining me, News Channel 5's medical expert, Dr. David Soria, also the Chief of Emergency Medicine at Wellington Regional Medical Center. First of all, I want to thank you as always coming in,
Good
Doctor.
to see you, Mike.
Let's get right to it. How is ADHD different in adults compared to children?
Yeah, you know, there's a lot of similarities. The difference is really in how those symptoms manifest, because kids do kid stuff and adults do adult stuff. But the categories remain the same. You have inattentiveness, impulsiveness, and hyperactivity. But in children, you may see running, jumping, climbing, not finishing their homework, fidgety in class, losing things, blurting out answers, right? Those things are typical of ADHD in kids. In adults, you're not going to see that kind of thing. You're going to see tapping of their toes or foot, fidgety in their seats. They may get involved in high-risk behavior like alcoholism, drugs, sex. They're going to spend money excessively. They're not going to complete tasks either. So it's important to be able to identify the differences, because 50% of children with ADHD will go on to have ADHD in adulthood.
Wow.
But you're going to see things differently, so this way you can get the help that they need early.
That's a different set of things for
You
sure.
bet, you bet.
All right, let's talk about treatment for vertigo, and is there such a thing? What's the best treatment for it?
Yeah, well, vertigo, we've talked about this before, like we were saying, and what it is a spinning sensation, and typically peripheral vertigo is secondary to an asymmetry in the vestibular apparatus of your inner ear. So one of the most effective treatments is something called the Epley Maneuver, which is just a repositioning of your head, which can dislodge some of the crystals that are in that labyrinth and take away the asymmetry and thus eliminate some of the spinning sensation. It does work. However, sometimes it doesn't, obviously, and you're going to need medications like meclizine or Valium that can help take away or attenuate some of the symptoms of the spinning, the nausea, and the vomiting. But one very important thing, and that is that central vertigo can present very similarly with the same spinning sensation, but that's indicative of a bigger problem. That could be an early stroke in the posterior part of the brain. So if you have risk factors like you're over 50, high blood pressure, or diabetes, and you develop vertigo, please call your doctor immediately or come see us in the emergency department, because it's something that needs to be checked out right away.
When you say a repositioning of the head,
we lay the patient down, and there's a maneuver with the head where we try and move the crystals from the inner part of the labyrinth outside of where the cilia are, which are causing the symptoms.
Okay, very interesting.
Yeah.
Today we talked about ADHD, vertigo. Maybe you have a question for the doctor. You can submit it. Just go to our website, WPTV.com. Click on the health link. To get there, you just have to scroll down on the right-hand side. You'll see a form where you can write your question. Doctor making a house call. Thank you very much for joining us. And we'll